Cancer is a complex disease with various forms and causes, and it remains one of the world's leading health concerns. The good news is that with advancements in medical science, early detection of cancer can significantly increase the chances of successful treatment and survival. This guide is designed to equip readers with the knowledge to identify common symptoms associated with cancer, understand why these symptoms occur, and appreciate the importance of regular screenings in preventive healthcare. Cancer does not always present with obvious symptoms in its early stages, and some signs can be subtle or mistaken for other health issues. However, being informed about these signs can help you act promptly and consult a healthcare professional if something feels unusual. Early detection remains one of the most effective ways to treat cancer, so understanding these symptoms and when to seek medical advice can make a life-changing difference. Unexplained weight loss, a potential early indicator. Understanding the warning sign. Losing weight without any intentional lifestyle change, such as a new diet or exercise program, is often a cause for concern. If you notice a drop of over 10 pounds in a short period without explanation, this may be an early warning sign of cancer, particularly cancers of the pancreas, stomach, esophagus, or lungs. The science behind weight loss in cancer. Cancer cells have a high metabolic rate. They consume more energy as they grow and spread, leading the body to burn more calories than normal, even during rest. The body often responds to cancer's presence by releasing proteins called cytokines, which speed up metabolism and break down fat and muscle tissues at a faster rate than the body can replace them, contributing to unintended weight loss. Advanced cancers may result in cachexia, a condition characterized by extreme muscle and fat loss, which further complicates patient health. Diagnostic measures for unexplained weight loss. When unexplained weight loss occurs, it is essential to consult a doctor who may order a series of tests. These could include blood tests, imaging scans such as CT or PET scans, or metabolic assessments to better understand what may be causing this weight loss. In cases where cancer is detected, early treatment can be initiated, significantly improving prognosis. Preventive tips and lifestyle adjustments. To maintain a healthy weight, it is beneficial to follow a balanced diet, avoid processed foods, and stay physically active. Regular health checkups, including blood tests and metabolic assessments, can help detect issues before they become severe. Adopting a lifestyle that includes exercise and mindful eating can help maintain a stable weight and improve overall health. Persistent fatigue, when tiredness could be a sign of something serious. Identifying the symptom. Feeling tired is common, especially in today's fast-paced world, but cancer-related fatigue is different. It often persists despite getting adequate rest and sleep. This type of fatigue can be overwhelming, affecting the ability to perform daily tasks. Cancers such as leukemia, colon cancer, and stomach cancer are known to cause this form of fatigue as an early symptom. The biological basis of cancer-related fatigue. Cancer cells disrupt the body's normal functions by interfering with the blood's ability to carry oxygen and essential nutrients, leading to a chronic energy deficit. For example, in leukemia, cancerous cells infiltrate the bone marrow and reduce the production of red blood cells, causing anemia. This decrease in oxygen carrying capacity results in intense fatigue that doesn't improve with rest. Diagnostic approaches for persistent fatigue. A healthcare provider may begin with a physical examination, followed by blood tests to check for anemia or other potential underlying causes of fatigue. In cases where anemia is identified, further diagnostic tests such as bone marrow biopsies may be conducted to determine if leukemia or another form of blood cancer is present. Preventive and supportive measures. Managing fatigue begins with balanced nutrition, adequate hydration, and sleep. For individuals undergoing cancer treatment, integrative therapies like physical therapy and mental health support can help reduce fatigue and improve quality of life. Avoiding caffeine in the evening, engaging in gentle exercise, and practicing stress-relieving techniques like meditation may also help manage fatigue. Skin changes. Recognizing the warning signs on your body's largest organ. Spotting skin-related symptoms. The skin is one of the first places that often shows signs of internal health changes. Look for symptoms like yellowing, jaundice, unusual lumps, persistent itching, moles that change shape or color, and non-healing sores. While many skin changes are benign, certain types of skin alterations can indicate underlying cancers such as skin cancer, liver cancer, or even pancreatic cancer in the case of jaundice. Why these changes occur? The skin reflects changes in blood composition, circulation, and immune responses. For example, jaundice is a yellowing of the skin caused by an excess of bilirubin in the bloodstream, often due to liver dysfunction or obstruction in bile ducts, conditions sometimes related to liver or pancreatic cancer. Additionally, cancerous cells disrupt healthy tissue, creating visible skin changes. Diagnosing skin-related cancer signs. Dermatologists use diagnostic tools like dermatoscopes, which allow for a magnified view of the skin to assess moles and lesions. When skin changes persist, a biopsy is often performed to analyze the cells and determine if they are cancerous. For jaundice and other systemic symptoms, blood tests and imaging may be conducted to examine liver function. Preventive steps for skin health. Protecting the skin by using sunscreen, avoiding excessive sun exposure, and wearing protective clothing can reduce the risk of skin cancer. Regular skin checks, either self-exams or by a dermatologist, are vital, especially for individuals with a family history of skin cancer. A balanced diet and hydration also support skin health. Persistent cough or hoarseness, respiratory indicators of possible illness. What to watch for? A cough that lasts more than 3 weeks or hoarseness that doesn't resolve may be a sign of lung, thyroid, or throat cancer. Although respiratory infections often cause these symptoms, chronic cough or hoarseness without other signs of infection should not be ignored. How cancer causes respiratory symptoms. Cancerous growths can obstruct airways or damage the delicate tissues of the respiratory tract, resulting in a persistent cough or hoarseness. Lung cancer, for instance, is known to cause a dry, persistent cough. Tumors in the throat or thyroid can press on the voice box, resulting in hoarseness. Methods for diagnosing respiratory cancer symptoms. Medical evaluations for persistent coughs may include imaging tests like chest x-rays, Connecticut scans, or even a bronchoscopy, which allows doctors to visualize the respiratory tract. A laryngoscopy may also be performed to examine the voice box if hoarseness is present. Prevention tips for lung and throat health. Avoiding smoking and exposure to pollutants are critical preventive measures. For those at risk of respiratory cancers, regular checkups are recommended. In addition, using air purifiers and wearing masks in areas with high pollution levels can reduce the risk of respiratory issues. Changes in bowel or bladder habits, digestive and urinary red flags. What to look for? Persistent changes in bowel habits such as chronic diarrhea, constipation, or blood in the stool, or changes in urinary patterns like blood in urine, frequent urination, or painful urination could indicate cancers of the colon, bladder, prostate, or kidneys. Understanding how cancer affects digestive and urinary functions. As cancerous cells grow in organs like the bladder or colon, they can block or narrow passages leading to altered bowel or bladder habits. In colorectal cancer, polyps may cause partial obstructions resulting in constipation or thinner stools. Blood in the stool may be a sign of a bleeding tumor within the intestines. Diagnosing bowel and bladder symptoms. A colonoscopy is one of the most effective ways to diagnose colon cancer, as it allows doctors to view the entire colon and remove any polyps for biopsy. For urinary changes, urine cytology, imaging, and cystoscopy are often employed to detect abnormalities in the bladder and kidneys. Preventive actions for digestive and urinary health. Maintaining a high-fiber diet, staying hydrated, and avoiding processed foods can help support digestive health. Regular screenings, especially for individuals over the age of 50, are recommended for early detection of colorectal cancer. Practicing good hygiene and staying hydrated also helps maintain urinary health. Unusual bleeding or discharge signals of possible tissue damage, recognizing the symptoms. Unexplained bleeding from any body part, such as blood in the stool, urine, or sputum, may indicate cancer. Discharge, such as bloody nipple discharge, may also be an early sign of breast cancer. Bleeding between menstrual periods or after menopause could indicate reproductive cancers. The biology of cancer-related bleeding. Cancerous cells invade nearby tissues, often causing lesions or sores that bleed. For example, colorectal cancer may cause polyps to bleed in the intestines, while breast cancer might affect nearby ducts, leading to bloody nipple discharge. Diagnostic steps for unusual bleeding. Blood tests, imaging studies, and scopes like endoscopy and colonoscopy help diagnose the source of bleeding. In cases of reproductive bleeding, PAP smears and biopsies of the uterus or cervix may be conducted to check for cancers affecting these areas. Preventive approaches. Avoiding smoking, consuming a balanced diet, and maintaining regular checkups can reduce the risk of bleeding-related cancers. Women should have regular PAP smears and mammograms as part of their preventive health regimen. Pain. Persistent localized pain can be a significant warning sign of cancer. When pain indicates more than just usual discomfort, it's crucial to pay attention. Chronic, unexplained pain in a specific area, such as the back, abdomen, or head, may signal underlying cancer. Pain that doesn't improve with standard treatments could point to issues in nearby organs or tissues. The biological mechanisms of cancer-related pain are quite complex. Tumors may press against nerves, causing pain. For instance, in ovarian cancer, tumors may put pressure on the abdomen or back, leading to persistent pain. Similarly, brain tumors can cause headaches that worsen over time and don't respond to usual treatments. To diagnose the source of pain, MRI and CT scans are often utilized to visualize structures and detect tumors that may be pressing on nerves or tissues. In cases of nerve pain, nerve conduction studies may be performed to assess any disruption. Managing and preventing pain is essential. Physical therapy, pain management techniques, and supportive therapies can help alleviate cancer-related pain. Practicing good health habits, including regular exercise and avoiding carcinogenic substances, may also reduce the likelihood of pain-inducing cancers. Difficulty swallowing or indigestion can be indicators of digestive cancer. When swallowing becomes challenging or painful, it may be due to cancers in the esophagus or throat. Indigestion that doesn't resolve with diet changes or medication could also be an early sign of stomach cancer. Cancerous tumors in the throat, esophagus, or stomach can block or narrow passages, causing discomfort during swallowing. These tumors disrupt normal digestive processes, making eating painful. An endoscopy is typically performed to assess the esophagus and stomach, allowing doctors to examine and biopsy suspicious areas. Barium X-rays can also provide images of the digestive tract to check for abnormalities. Avoiding smoking and excessive alcohol consumption reduces the risk of esophageal cancer. Eating a balanced diet with adequate fiber and staying hydrated supports digestive health and reduces cancer risks. Night sweats or fever can be the body's immune response to cancer. Recurring fevers or night sweats, especially without other infection symptoms, can suggest blood cancers like leukemia or lymphoma. Cancer affects immune function, leading the body to produce fever as it attempts to combat abnormal cells. Blood tests, bone marrow biopsies, and imaging tests help identify blood cancers. Balanced nutrition, regular exercise, and vaccinations can support immune function and reduce cancer risk. Additional preventive measures for overall cancer awareness include a balanced diet and nutrition. A healthy diet with fruits, vegetables, and lean proteins supports cellular health and immune function, reducing cancer risks. Regular physical activity reduces inflammation, improves oxygen circulation, and supports immune health, reducing cancer risks. Routine screenings are essential for detecting cancers early, particularly for those at risk. Limiting tobacco and alcohol can significantly reduce cancer risk. In conclusion, recognizing symptoms and the importance of preventive healthcare empowers individuals to take proactive steps.